Early intervention include provision of services to children with CP and their family to lessen the effect of condition. Services should not be denied on the pretext of confirmed diagnosis of CP in cases not established until child 2 or 3 year old. Any child with positive antenatal, natal, postnatal histories, risk of developmental disability should have access to early intervention services. These are designed to identify and meet children's need in 5 developmental areas: physical, cognitive, communication, social or developmental, sensory and adaptive development. Early intervention services to identify and meet children's need: physical, cognitive, communication, social or emotional, sensory and adaptive development. Muscle tone increase with age in caudal to cephalic, feet to head and distal to proximal extremity to trunk. Active muscle tone observed during spontaneous movement develops before passive flexor tone is seen at rest. Full-term infant has predominant flexor tone. Hypotonia is normal for preterm infant and exhibit greater extension and less physiologic flexion than a full-term newborn. Twitches, tremor, startles common in preterm. Movement become even as the term period approaches. Assessment of muscle tone based on state of arousal and medical status. Preterm infant may be active and awake but hypotonic during sleep. Screening of eye and ear is required in initial assessment to rule out visual and hearing impairment. Due to hypoxic ischemic encephalopathy, prefrontal cortex might be affected, exhibiting behavioral problem in the child, making rehab a challenge. Intelligence social quotient or intelligence quotient can be assessed by several scales. Aim of rehab in high risk child for cerebral palsy is early intervention in all areas of development to achieve maximum functional independence. Independence. Birth age, birth weight, Apgar score, breastfeeding, medication history, supportive measures during the hospitalization, age, weight, condition on discharge, means of feeding, need for ventilator or other support from hospital, weak lip closure or weak sucking force, weak lip closure, inadequate feeding, sign of oral motor dysfunction, neonatal seizure may signal pre or perinatal brain damage in newborn and young infant. State of alertness, activity and comfort influence muscle tone. If the child is restless and crying, examination for muscle tone should be deferred. Increased tone